Welcome to the Halachic Grand Rounds number 4. This is our fourth such meeting where we at least try to make an interface between Halacha and medicine. Tonight we're having a little bit of a mix-up, I guess, so we're going to turn the order of the presentations around. So tonight first we're going to hear from Rabbi David Cohn from the Chicago Rabbinical Council.
Good luck, everybody. Thank you for coming out. And in fact, it is backwards because I myself was looking forward to hearing doctors speak first. I know a certain amount about celiac disease. I've actually recently learned that a niece of mine does in fact have celiac disease. I'm sure most of the people here in the audience know more than I do. I'm just going to talk just a minute just to get us started. And I'm going to then be speaking about how a person who's a celiac will do the mitzvahs that they have to do at the Seder, or for that matter, for the whole Pesach. Celiac there are people who have allergies or other difficulties in eating wheat and certain grains. Okay? Typically, for most people, those things are not as serious as someone who has celiac. A person who has celiac disease it's my understanding, does not directly react to eating the wheat. It's not as in an allergy. Their intestines react to it and make them not be able to absorb other foods later on. So it's not that the eating of the wheat is a direct... Go ahead.
Yes, unfortunately that's not correct.
Okay, good, go ahead.
Celiac disease causes an automatic immune reaction in the small intestine, preventing the absorption of any nutrients. Persons who have celiac disease, it could also cause dermatitis epiphthalmitis, which is a skin breakout, which is very immediate.
Okay.
It causes terrible health problems, diarrhea, vomiting within an hour.
Okay.
The reactions for celiacs are extreme.
Okay.
And to say that it's...
No, so what I meant to say, I'm sorry, again, I'm not the doctor. What I meant to say was a person who's allergic to wheat, who has an allergy to wheat, then his allergy is to the wheat itself. Whereas here, if I understand correctly, as you had said, it affects his small intestines, and therefore he doesn't absorb other foods. Well, since it affected his small intestines, therefore he'll have diarrhea from that.
It can also cause...
A direct reaction.
It's not just the diarrhea. It also changes the blood-brain barrier, which allows toxins to get into the brain.
Okay.
It causes ataxia of the brain. It causes behavioral problems. It's a tremendous.
Okay.
It's not such it's a very dangerous.
Okay. I didn't mean to minimize the danger. I wasn't saying it from that side. Just I understood that it worked differently than an allergy. You're saying that it has those elements sort of like an allergy also to it.
No, this is different than an allergy.
A different allergy. Okay.
It's like a poison. It's because it's a poison. You take a poison, that's what it is.
Okay.
It's not an allergy. You get a reaction. You eat that, it's ingesting the equivalent of poison.
Okay. Okay.
Autoimmune disease.
Okay.
Allergy is not an autoimmune.
Okay, I take it. Okay, so I accept that. I'm good again as not being the doctor, and I had wished we would hear the doctor first to explain the different levels of how people react to it, etc. That's what we're hoping, and maybe he will still be here to explain that. I'm going to talk just from my perspective on a more limited meaning in a theoretical sense, and we will see how it applies to these people. Every Shabbos, a person has a responsibility, has a mitzvah to eat 2 or 3 meals that include bread in them. And of course, for a person who's a celiac, that's a difficulty. Every Shabbos, how will they eat lechem mishnah? Okay? But at Pesach, it's that much more of a serious concern because there's a mitzvah from the Torah that they have to eat. The first night of Pesach, they have to eat matzah. So how will they eat matzah if they can't eat what the typical matzahs, which are the regular matzahs that we eat? So that's the special difficulty that we're here to discuss. The first question is, let us say that a person will have a very serious reaction to eating a food. In our case, that we're discussing, a person who's a celiac will have a very strong reaction to eating the matzah at the Seder. What is his responsibility? Does he have to do that mitzvah? He's sitting there at the Seder. He knows if he eats this matzah, some people, if they eat the matzah, it could be deadly. So for some people, it's a question of a sakana, and obviously those people shouldn't eat the matzah. We're talking about a person who's it's not a potential for danger. Okay, again, that's his doctor's call as to, is it a danger? but he will have a strong reaction to eating that food. Does he have to do the mitzvah or does he not? Okay? Before we get to, we have options for what he could do instead of that. But let's just say he was sitting there at the Seder. The matzah that's there is plain old, regular matzah to eat, plain old wheat matzah. Does he have to do the mitzvah or not? So many people's first reaction is, if it's not a sakana, I don't have to do it. Then I have to do it. We've been taught that if it's a sakana, you have to do it. If it's a sakana, you don't have to do a mitzvah. If there's any danger, if there's no sakana, many people's first reaction is, if there's no sakana, then I must do a mitzvah. If it'll make me sick, I'm going to be in bed for the next 3 days, I have to do it anyhow. In fact, that's not the truth. The din is that a person is only required to spend up to a fifth of his money in order to do a mitzvah aseh. Okay? If a mitzvah aseh means a mitzvah that I have to go out and do, like I have to shake a lulav, and I have to eat matzah at the Seder, and I have to sit in this, I have to do something, an action to do that mitzvah. To do that mitzvah, there's a limit to what I have to do for that mitzvah. Whereas a mitzvah's lois aseh, let's say if someone wants to eat tray food, then I have to spend, no matter what, up till it's a potential danger to me. But a mitzvah's aseh, a mitzvah when we say a person has to actively, this is doctor, should we pause? Okay, so I'm going to finish this section, and then I'll let the doctor speak, he can speak, go on. So when a person has a mitzvah aseh to do, they only have to spend up to a fifth of their money. And there's a question in the person can talk about, what happens if it's not a question of money, but it's a question of my health? Okay, not a question of sakana, just a question of I will be what we call a chayla she'emar sakana. I will be a person who will be sick to the point that I'm going to be incapacitated. I'll be not myself for a while, or for a day or two, or for a couple of days. What does that person have? Does that person also get excused from doing the mitzvah aseh? And in many cases, that's exactly what this person who has a celiac disease will be. The doctor will tell him, in your case, it may not be a sakana, but it's going to knock you out for the next 2 days, you're going to be out of commission. So there's quite a discussion in the poskim whether that person is or is not required to do the mitzvah. Yes, go ahead.
Do you not have poison?
No.
Let me answer the question. There is no, I don't understand you're talking about that somebody could tell somebody with celiac, go ahead and eat something that has gluten in it. Because it's a poison. No, but you keep saying or alluding to, well, it may not be a sakana. How do you know?
So I said, that's a
I just get,
So I said is that's a question for his doctor to answer. Go ahead.
The Poison Control Center says that drinking bleach is not toxic. You throw up before you drink enough that it would be damaging to you. Would you say drinking bleach is sakana?
Yes, I would.
Well,
okay.
That's
So
what you're saying.
so again,
your perspective from where you're starting is kind of
it's a faulty start.
So I'm happy. I'm willing to accept that. I'm not debating that. I'm saying it's like this. I said, if the doctor were to tell the person, I'm saying, I started. If the doctor says to the person, the item that you're eating is a safek sakana, then there's no question he shouldn't do it. Okay, that's the perspective I'm starting with that. But now the question is, let's say the doctor, it's not that. If you were to eat it...
The person is celiac.
Okay.
It is not a question that you are celiac, but go ahead and eat this. No. See, because once a person is diagnosed with an autoimmune disease, they have it. The same way that if a diabetic eats sugar and falls in a coma, you see that. You don't see what's happening to a celiac. It's not in your sight. So if this person in 5-10 years has another autoimmune disease, chas v'chalila, even diabetes or leukemia, because they're diagnosed with celiac and they go ahead and eat it because some American doctor who didn't go through the right program and really doesn't test for celiac because it doesn't exist, because the drug companies have told them, I'll let the doctor talk about this, but you see where I'm going. Everyone in the room sees where I'm going with that statement.
Okay, so I'm not arguing with you. I'm willing to accept that. And that's why
Are you saying, essentially, if you're not allowed to eat it, then you shouldn't worry about eating matzahs. And you could just say that.
No, I didn't say that. No, I did not say that. I said this. I said, and that's in truth why I'm supposed to be speaking second. If the doctor says from eating the matzah that's a question of a sakana, then yes, then there's no question he shouldn't eat it. My question is, if there is such a thing, and if you tell me that there's no such thing, then I'm happy to accept that. Dr. Kaslow is going to speak in 30 seconds. He's going to be up here. Okay, if that'll make you feel better. Dr. Kaslow is going to be here in 30 seconds. He's going to be up here. And if he tells us, I'm not debating that point. If we say that we have something that will not cause that, there is a question. Okay, whether a person to do a mitzvah say has to make themselves sick, not in the sense of making themselves deathly sick. Well, they have to make themselves sick. Okay, and there's quite a discussion. I'm going to get back to myself because I'm finishing. The doctor's on in a second. That the one who speak the most about it is a sage called Binyan Shlomo, who goes back and forth to quite a discussion about it. And his conclusion is, and many of the Achronim accept that.
What do you consider deathly sick? Do you consider deathly sick we're going to drop dead right now, or they're going to drop dead in 10 years?
Okay, so
Where's that line?
okay, so, I obviously don't mean that he needs to drop dead today. I don't mean that. Whether if it'll have an effect in 10 years, that's a more of a complicated question to that. Whether that is or is not a sakana. Okay.
Fully kill yourself.
No,
What do you think? Deathly sick means if you eat gluten and you have celiac disease, it's going to hurt you and it's going to cause permanent damage if you keep doing it. So that is deathly sick. You're going to end up with cancer. You're going to end up with diabetes. You're going to end up with all sorts of things that are going to kill you slowly.
So my
Or if you have dermatitis epidermolysis, you're going to break out all over your bodies with sores. They're going to be open wounds that could be open to infection. Anybody who has celiac disease and is having a celiac reaction has a lower immune system so that they can't fight off diseases as well. The doctor can tell you all this. This is what our doctor tells us. So what's your definition of sakana?
So again, we're talking about a person who's eating one time of eating the matzah, and I'm again willing to accept if you tell me that from eating one time, he opens himself up to that kind of reaction, then yes, it's a sakana, and no, he should not eat the matzah. That's not what I'm talking about. That that's why I preface myself. The question is if our only choice was to eat this matzah, and he will not, from his eating one piece of matzah, cause himself that kind of a reaction, just said he'll be sick. And without being that kind of a reaction, that was the question whether you have to go even to that extent to do a mitzvah. Okay, that was where my starting point. Again, the people you're arguing, I'm not. I feel we're debating. Maybe I'm not sensitive enough to what people have. Maybe I'm sorry. In which case, I apologize. So the Binyan Shlomo says that a person is not required to do a mitzvah say if that will make him sick, even if it will not lead to sakana. Just a sick, like as in a person's out of commission, he'll be knocked out, he'll have some kind of a strong reaction, even if there's no even far-fetched way of getting to that sakana. Many of the Achronim accept that. And I asked Rabbi Schwartz, and his feeling was also to accept that. And therefore, even if a person was in a situation where the mitzvahs say, like eating matzah, would not cause him sakana, but would just make him very sick, a person is not required, just like you're not required to spend more than a fifth of your money to do a mitzvah, a person is also not required to make themselves sick in order to do a different mitzvah say. So with the person sitting there who has that, if that were his only choice, he was standing there with his matzahs, and he said, if I eat this matzah, for the next 3 days I'll be sick. Even if there's no possibility of sakana, he's not required to go ahead and do that to do the mitzvah in a way that will make him sick. Okay? I will continue afterwards with other options that he has, but thankfully the doctor here will continue.
Thank you very much. I want to apologize first of all. I spent Shabbos in Rosemont at my niece's Shabbat brachos, and they were holding a very long Shabbos, so I apologize for being late, and I appreciate everyone coming out on this rainy, well, it's only Shabbos, a week before Pesach. I'm sure that, this is a handout, yeah, that's okay. I truly appreciate your coming out. My secretarial staff was kind enough to make handouts for everybody. And let me first of all thank Dr. Mark Freeman for being the catalyst for this entire discussion. I think some of you know me. I am the son-in-law of the late Mrs. Matzah Stern, brother-in-law Sussie Stern, and I've been coming to Pesach for the last 20 years since I got married. Unfortunately, now with my mother-in-law's passing, we're not coming this year to Chicago for Pesach. So Mark called me and said, "You come for Pesach, come a day early, and we'll have this discussion about celiac." So I said, "I'm actually not coming this year for the first time in my married life, but since my niece is getting married, and I'll be in 2 weeks before Pesach." So he said, and I said, "The only time I can do it is Matzah Shabbos," and he said, "Fine, I'll do it from here."
You could put that.
No, I'll do it from here. And will it stand up there?
Yeah.
All right, so I'll leave it up to you. Technologically, I'm a dinosaur. But in any case, first of all, I want to thank Mark. I want to thank all of you for coming. And this is a lecture that I give to medical audiences. I did not dumb it down. I tried to condense it a little bit because of time constraints. And I see I have a crowd here with a lot of Islavas. So I'm not going to talk as fast as I thought I would because I think this crowd is interested in the medical aspects of it as well. I want to thank the rabbi for being in touch with me in advance. We had a little bit of discussion. He sent me a very nice fax about a topic we're going to talk about a little bit later. So let's get started. And I'm going to try to cover the topics which I think are critical to this audience in particular. And what I don't cover in the formal lecture part, I hope to be able to answer with the questions and answers at the end. And if anybody's under time pressure, by all means, I will not be insulted. If you have to leave early, that's fine. I'm just missing another meal and some speeches, so I'm not in any rush to leave. So, and I'm really full. All right, so let's get started. You have the handouts in front of you. I hope everyone has it. If you want one, if you don't have one, there's still a couple extras on the table. So the slideshow should go along with your handout. First of all, there are many different names for the condition we're talking about. The most common name is celiac disease, which you have on top. We don't like to use that term. It's not a disease. It really is. It's an allergy. But that's the most common term that is used, even amongst medical professionals. Celiac sprue is another term. That's a somewhat more descriptive term. The one that we like to use, and probably which is the one which is the most accurate, and I think we have some patients with celiac here in the audience, it's a gluten-sensitive enteropathy, meaning you have a sensitivity to gluten, and what it does, it causes an enteropathy. And enteropathy means it causes a certain amount of inflammation or damage to the small intestine. That's probably the best term without a stigma, etc. And in the old days, what are these machines over here next to me? Those make the slides go, huh? Recorders. I'll be fine. If I need help, I'll ask. Okay, click this one, right? All right, fine. I got a basic lesson. This is my first presentation in PowerPoint, so bear with me. I told Mark I always do this in the slides, and everybody went to great trouble to get me a slide projector, but I had my staff put it together in PowerPoint, so bear with me. But anyway, this is something we call tropical sprue. This is not tropical sprue, but we like number 3 as the best thing. Now, I happen to be personally very interested in the history of medicine. So the next part of the lecture, I'm going to talk about some of the history of celiac, which I find very, very fascinating. I hope you will as well. So Areteus the Cappadocian in the 2nd century talked about malabsorption with fatty stools, emaciation, ascribed to problems with digestion. In its pristine form, that is a fairly apt description of the non-treated patient with celiac who has symptoms. Okay, we're going to be talking a lot about the patients who are asymptomatic, which is probably at least 50% of patients. So that's a pretty good description in the 2nd century. This is Dr. Samuel Guy, who lived in the, I believe, 19th century. I think I have his time here, 1888. So he is credited as being the first one to begin to consolidate the idea of celiac. So he says celiac affection is an infantile diarrhea. Okay, so that's interesting in that, again, classically, we always thought about celiac as being relegated to children, to pediatrics. I think you know, or maybe you don't know, I'm a pediatric gastroenterologist, and celiac was thought to be a disease of children, diarrhea and malnutrition, and that included most of the features that today we use to describe celiac. Now, people of around my age, and I'm just past my 50th birthday, not just past, a few years past, people around my age or older, very often I will have parents coming to the office with their children, and they will say to me, I was a celiac baby. Now, what happened is that the field of pediatric gastroenterology really took off, really was born in the 1970s going to the 80s. I graduated medical school in 1980. And pediatric GI was probably in its infancy in the 70s. So what happened was people used to describe babies with diarrhea or babies with what we call failure to thrive, babies with absorption issues as quote-unquote celiac babies. Probably a small portion of them had celiac, because these parents would tell me that I was a celiac baby, they're 6'4", and 185 pounds, and they're very, very strong. They didn't have celiac. They had some sort of nonspecific kind of infantile diarrhea. Some of them may have had it, but celiac is not something you outgrow. If you've got it, you're kind of stuck with it. Okay, I'm not going to read this whole thing, but in your handout you can read the fact, and I'm just going to read the last line, that it talks about a very stinking stench of the bowel movement, and it says the food having undergone putrefaction, okay, rather than what he calls concoction, which is a nice, interesting way of 19th century English saying is that you're having malabsorption. The food is not being absorbed. Now, Dr. Gee already realized in the 1800s, if the patient can be cured, it must be by means of diet. And that is true then, and that is true today, 140 years later. The next interesting breakthrough with celiac actually comes in World War II. So, for those of you who are buffs of the World War or history, etc., so in the early 1940s, the Germans invaded the lowlands, including Belgium, and including at the top of your map, the Netherlands, which is going to be very important. This is what the world looked like in 1942, where they controlled a very, very large portion of Europe, and for that matter, Northern Africa. Now what happened? There's no food. The people had little or nothing to eat. There was widespread starvation. Okay, the war ends, and then what happened was, and my slide got taken out of order, maybe it'll come in a little bit, but Dr. Dick, who was a doctor in the Netherlands, made a very interesting observation. It'll probably be a few slides later, but I'll get to it. He found that a large number of patients, again, mainly children, who had this sort of intractable digestive issue, intractable diarrhea, got better during the occupation. And when the war ended and food, particularly bread and wheat, became available again, they got sick. So in 1950, he began to put together the combination of childhood malabsorption, diarrhea, abdominal pain, etc., with wheat. All right. So, being here in the Midwest, I had to put up my Midwestern wheat girl, and this is the main part of the problem. Now, it's actually not the whole wheat, okay? But if you look at this schematic of the wheat molecule, it's really the second one from the top, which is the protein, okay? The wheat / gliadin, which is the wheat protein, this is where the gluten is found, and this is where the problem lies. Now, another thing I always love is sort of the interface between my medical studies and my halachic studies. So when I was first starting out, so we were taught in medical school and later on in my training that what constituted the problem with celiac was the chameshes minei dogim, wheat, oats, barley, rye, and spelt. And that was the classical teaching for many, many years. So I'll stop at this point and point out and say to you that that teaching has become somewhat modified. We have found that, and I don't have a slide to show you, but we have found that actually oats are botanically different than the other four. Now let me backtrack for a second and talk about spelt. Very often I would have patients come to me and say, well, this is wheat-free, this is gluten-free, I'm on a spelt diet. Okay, this is a very common misconception. Spelt is just another form of wheat. It's a form of winter wheat. So spelt is filled with gluten. However, oats are not. And the modern teaching now is that patients with celiac may indeed be tolerant of oats. And the rabbi is going to probably address that a little bit later, and I'm going to address it a little bit myself as well. The big problem with oats, until recently, until we became somewhat more sophisticated and knowledgeable, is that there's something called cross-contamination that the patients in the room who have this condition are aware of. Is that even though the oats themselves may not be a problem, but if they have been processed in a plant that processes wheat, that processes any of these other grains, they can have remnants of the gluten sort of attached to the final product. So that cross-contamination has always been a very, very real issue with oats, but now that the whole world is becoming much more knowledgeable and sensitive to the needs of the celiac population, it is possible to get what we call scrubbed oats and oats that may be tolerated by the patients. And there's a lot of studies coming through the literature now looking at patients who have celiac and whether or not they are tolerant of oats. And I would say probably the majority of the studies, although not all, suggest that most patients with celiac probably will be able to take truly scrubbed and pure oats that have not been cross-contaminated. The next series of slides will talk about some of the etiologies, some of the explanations of why celiac exists. It's hard to understand, it's hard to fathom in terms of what is it about this combination of wheat that causes individuals to become ill. So these are the things, and we'll elaborate them as we go forward. Yes?
Is there any research on trying to genetically take that protein out of wheat?
There is work going on, but I have to say, honestly, that given the priorities, and this has just become sort of a financial thing, given the priorities of illness and disease, the fact that this condition can be treated with just a diet makes that kind of research, and a lot of the research, very low priority in terms of funding. But there is some work that is dedicated to that which you asked. Why did individuals get this condition? Why do they get celiac? So one theory, and this is based on an article from the New England about 8 or 9 years ago. One theory is that there is a decreased secretion of CCK, cholecystokinin, and secretin, which are digestive enzymes. Another one is you have decreased delivery of bile and pancreatic enzymes. And the third is there's decreased enzymatic activity in the lining, what we call the brush border of the small intestine. None of these theories is entirely correct, and as is often the case, it's probably a combination of all of the above. The next hypothesis is something called the lectin hypothesis. And we'll go with number B, which is a little bit more easy to understand, is that a lectin is thought to be sort of a compound, complex. And it's thought to be that there are fractions of the wheat protein, of the gliadin, which are incompletely digested and sort of stick, as it were, or become bound to the lining of the intestine. And there's something about that combination that sets up this, it's ultimately an immunological condition, that sets up this immune reaction in a person who is predisposed to the condition. We definitely know that there are genetic factors involved, that patients with celiac often, but not always, will have certain genetic loci The top one is the DR3. I think I have a slide later on that elaborates on this a bit. So the DR3 actually is a locus in the gene that you also will often find patients with diabetes mellitus. I will talk about this later. Now this is interesting, is that despite that, you have a discordance among identical HLA, identical siblings, and identical twins. Okay. However, I just had a set of identical twins with identical intestinal biopsies of celiac. However, the twins were phenotypically, in terms of the presentation, they were identical in every which way. One twin had all the symptoms. The other twin had no symptoms. And when I tested the twin who had no symptoms, his intestinal biopsy and his blood work was identical to the other one. So it's a condition which is endlessly fascinating. And as I said before, we know that this is an immunological condition. It is among the genre of so-called autoimmune conditions. Just like in diabetes, the body views the pancreas as foreign. In lupus, the body looks at the kidney as foreign. In celiac, the body looks at the lining of the small intestine as foreign and attacks it with so-called T cells. And we know that it ultimately creates these so-called anti-gliadin antibodies and others, which we'll talk about later, which we use to measure the presence or absence. And in the intestinal biopsy, you have an increased number of what we call intraepithelial lymphocytes. That's the first sign of celiac disease that we see histologically in the laboratory. In terms of the criteria to make the diagnosis, this is the classic condition, the classic presentation. Okay, you need to do an intestinal biopsy, see a damaged villus, then you take the gluten out, and then in the old days, what they used to do, they used to go and repeat the biopsy after a gluten challenge. We don't do that anymore for a variety of reasons. The main one being the fact that we have the blood tests, which are very accurate and precludes the need to do recurrent and constant intestinal biopsies. This is a schematic of the intestine. We are constantly talking about villi. Villi is a Latin term which means a finger. This here in the upper right-hand corner is what a normal intestinal villus looks like, all blown up. If you look at this over here, you can see a normal intestine has these finger-like projections, and these finger-like projections is what enables us to absorb nutrients. And it allows our intestines, which are relatively short, to absorb all the various vitamins, minerals, and nutrients that we need. Okay, so in the middle, you have a normal intestine, because that's what it looks like. Again, these little finger-like projections. On the left, you can see it's like somebody came with a shaver and shaved off all those little fingers. And that's what we call a so-called flat villus, a flat villus lesion. This is another example. Again, if you remember the one, the slide before, this is the surface here. This is the surface. If I put the camera, my endoscope, through the mouth, and I'm going to show you an endoscopic picture in a moment. Okay, so you're looking at the intestine from the inside. Okay, and then we do the biopsy. This is what we call the luminal surface. And you can see it's like somebody came with a lawnmower or a shaver and shaved off those little fingers. And if that's shaved off, you do not have the ability to absorb the nutrients which are required. This is the view from the endoscope. And these days, we do all of our intestinal biopsies through the scope, which is another change in how we used to practice when I was first starting out in my career. It's interesting to me, and we'll probably talk about this a little bit later. I finished my training in pediatric GI in 1986. Okay, so I've been doing this for approximately 25 years. When I was in training, we diagnosed patients with celiac once or twice a year. Okay? One of the reasons is that to do the intestinal biopsy, we used to use this contraption called the Crosby capsule, which is now somewhere in the Smithsonian Institute. I still have one left in my office. It was so difficult and so unpleasant to do the thing. It was the size of a horse pill, and it's difficult, I think, for an adult. It's difficult, I think, for an adult horse to swallow a horse pill. Okay, so try to get a 2-year-old child to swallow it, which is almost impossible. And then we had to stuff it down their throat. And then we had this mechanism where we tried to get it to sort of suck onto the intestine and fire. Then we had to pull it out, and then half the time it didn't work. So we hated doing it. The patients hated having it. And the realities were that, I'm telling you, we diagnose patients once or twice a year. Today, in what year are we in? 2009? All right, today, I diagnose patients with celiac once or twice a week. Okay? So that is a 50-fold increase in the diagnosis of this condition. 50-fold just in my relatively short career for a variety of reasons, which we'll get to. But anyway, this is a picture from some Italian doctors. They talk about, in the lower left-hand corner over here, they talk about what they call scalloping. Again, it's a little bit hard to see, make out, but normally the intestine should be smooth, which is the one on the right, and this one on the left has like these little indentations. I have to tell you honestly, at the end of the day, it's what we call a histological or a pathological diagnosis. Sometimes I know going in the patient has it. You say, oh, this looks like those Italian pictures. It doesn't. You can't tell by looking. This is a biopsy disease. You can only tell by looking in the pathology lab. Talk a little bit now about the presentation of the patients. Okay, and you can read this for yourself. I'm not going to spend time reading it for you. But for us, particularly as pediatricians, the most common presenting cause is the one right below the bottom, which is chronic diarrhea. That's the most common. The one above it, you see, again, pretty often as well, in different ages, that of growth failure. The other ones are very nonspecific criteria. Again, this is the same thought in a different format, but if you look again at the bottom three, growth failure, chronic diarrhea, vomiting in the young age group, those are the ones that are most commonly presenting. Now, if you go all the way to the right, you can see in the older child and adolescent, sometimes it'll only present with growth failure. And that's something which is very, very important to keep in mind. Again, many of you in the audience have this or know what I'm talking about, and some of you do not. Some of the people here are doctors in practice. This is a very, very important diagnostic criteria that if you ever have a patient who is not making the grade in terms of growth, in terms of development, this is a red flag. And this is one of the most important diagnoses to think about. And I think somebody in the audience mentioned already, if you don't think about it, you're never going to find it. I have endless articles in the lay literature, in the medical literature. And one article in particular, I remember someone sent me, it was in the back page of Newsweek. I don't even know if Newsweek exists anymore, but of a mother from the West Coast who described her child, who was taken to the hospital, was in intensive care. They thought the kid had leukemia, and they thought the kid had all sorts of terrible things, but no one at that point thought about celiac. And as soon as somebody thought about it, the diagnosis became clear, as it often does in retrospect, and then the kid got the diagnosis and was cured within a relatively short period of time. But you've got to think about it. We're presenting a paper at the upcoming GI meetings in the spring where we found that approximately today 50% of the newly diagnosed patients were what we call non-traditional presentation, meaning not diarrhea, not abdominal distension. Okay, I would say growth failure alone probably would constitute about, I would say, 1/4 of the patients that we're diagnosing. The other thing, we'll probably talk about this later, I hope, is the fact that we have begun screening patients, particularly in affected families. So we are picking up a large number of asymptomatic first-degree relatives in particular. I'll interrupt myself. I'm coming up with something new just right now, which again, those of you in the audience who are celiacs may want to think about this. In the last month or two, I've now diagnosed three sets of first cousins, meaning that whenever we have a newly diagnosed patient, we say all first-degree relatives have to be screened. Who's first-degree relatives? The mother and the father and the siblings. This one family, for whatever reason, it's a large family, it happens to be an Orthodox family, decided that they're going to tell, the woman said to her two sisters, why don't you check your children? And two other families, first cousins to the index patient, were found to have it. And in my own family, I got a call from my cousin, it's a second cousin, and she wanted to bring her son to me, but he was already over my age group, my age limit. He was already over 20. I said, he's just too old for me. So he went to another gastroenterologist, and he was diagnosed. And about 3 weeks later, his first cousin just came to me, a little girl, who has it as well. Now, I'm not even sure if this is in the literature yet, but I now have 3 sets of first cousins who have it. So this may be the way of the future, yeah.
Would you take on an 18-year-old patient?
I take until age 20. But I'm in New York. I'm in New York and New Jersey. Okay. All right. Again, in terms of symptomatology,
So inheritance then, yeah,
there is definitely
we don't know.
a genetic component, which we talked about. The inheritance, the inheritance is unknown, meaning it is not, underline not, a classic Mendelian recessive, meaning that those of you familiar with Tay-Sachs disease, with cystic fibrosis, etc. So you know you have 2 parents who are carriers, and 1 in every 4 has a chance of getting the condition. Celiac is not like that. Okay? It is actually actively being pursued in the Genome Project at Columbia, where I work, by someone who actually has it himself, and he's one of the heads of the Genome Project. But we still do not fully understand what the inheritance is. It clearly is something which has different levels of penetrance, meaning you can have 2 parents who don't have it and kids who do. It skips generations. And you can have a parent who has it and none of the kids have it. You have every combination. So its manifestation is quite unclear. But it is clearly, by the fact that we have all these families, it is clearly there is a genetic component. Question?
Yeah, you mentioned that for parents with children, okay, out of curiosity, if you have a family where there's a known something's going on, where there's a large presentation of people with celiac in the family, is there a specific age which you try to hit introduction of gluten for a new child?
I always tell families, any new baby born into a family that you know you have celiac, I always tell families, treat the new baby normally.
Mm-hmm.
Give the new baby a normal diet, okay, and then we start screening that baby, and if they're assuming they're asymptomatic, we start screening that baby at about 15 months. Okay, by age 15 months with a normal diet, the baby will have had enough exposure to gluten to set the whole process in motion if it's going to happen. Okay, but because it is so variable, okay, and this is something I feel very, very strongly about, I do not feel that anyone should be on a gluten-free diet if they don't have to be. So that we always say treat the new baby normally, and we'll screen. And the baby may be negative at 15 months, but if it has a brother or a sister who has it, we'll continue to monitor that baby periodically every couple of years, again with the blood test.
You screen them by blood test?
By blood test, yeah. That's the only way to do it. You can't screen with endoscopy because you'd be out of business very fast. This is one of my favorite. This is one of my favorite diagrams. This is the classic celiac patient. Okay, and it shows you. This is the classic celiac patient untreated. Classically, the patient will have a big protuberant abdomen, and if the patient has not been treated, they may have some edema. And the long eyelashes, okay, why do they have long eyelashes? This, I have to say, I never knew the answer to this question. There's a number of clinicians in the audience. I will see if anyone wants to hazard a guess. This is not generic only to celiac. Any patient with malnutrition has long eyelashes. Anybody want to hazard a guess why they have long eyelashes? I never knew the answer to this myself. So it turned out, until an old doctor told me the answer. It turns out that eyelashes are really normal length, but what happens is we have little fat pads in our eyelids. And because they have wasting throughout the body, so the fat pads recede. So it looks like they have extra long eyelashes, but they really don't. They have normal eyelashes, but that's just they have wasting of their fat pads. All right, now this is a patient untreated with celiac. It's interesting. This slide was given to me by one of my colleagues who spent a lot of time working in Israel. This is actually a Palestinian. When we talk about celiac disease, I'm going to talk about this at the very end. There are certain ethnic groups which seem to be more common than others who have it. Okay, number one in the world are the Irish. Number two, interestingly enough, are the Italians. And after that comes everybody else. Now, we think celiac disease is a disease of Europeans, of Caucasians, but this is a Palestinian baby actually that has it. And we are finding, again now in our research, that I in my own practice have at least one Hispanic family. I believe I have one black family. I'm not sure if they're truly African American, but the family is black. And in terms of some of my colleagues, we are again finding it in places where we wouldn't expect, meaning in the non-Caucasian population, which takes us back to that very first slide that we talked about in terms of the etiology, in terms of where it comes from, that there very well may be some type of environmental trigger as well. Somebody mentioned this before in the audience, and this is a very important thing to consider, that even in patients with no overt GI symptoms, no diarrhea, no stomach aches, but if they are small for age, so-called failure to thrive, not making the grade in terms of growth and or development, then this is something that's a red flag, and this is something that must be thought about. Now I'm going to talk a little bit about the blood tests, and I think really the blood test is what has revolutionized the ability to diagnose, and for that matter, the ability to follow. And again, I don't want to go into all the details in the nitty-gritty, but there are a number of different antibodies. This is the anti-gliadin antibody, IgA, anti-gliadin antibody, IgG. This is the endomysial antibody, which actually since been supplanted by something called the tissue transglutaminase. All these things are not that critically important, except the take-home lesson from here is that the blood tests are very accurate most of the time, and the blood tests help us follow the patients. What we usually will do, we have a patient in whom we suspect the condition, we'll get the blood test. If the blood test is positive, we'll follow that up with an intestinal biopsy, with an endoscopy, and if the two match up, under normal circumstances, we will only follow the blood tests. Patient goes on the diet, the blood tests revert down to normal. So the blood tests have really revolutionized our ability to follow these patients. There are a certain number of false negatives. There are a certain number of false positives. There are certain patients who can have the condition and have normal blood tests. That exists. Although we feel, particularly in pediatrics, that's rare. In the adults, it's a little bit more common. Same basic idea as before. The endomysial antibody, or the tissue transglutaminase, TTG, is thought to be extremely sensitive and extremely specific. Another interesting thing in celiac patients is that very often they are missing IgA, which is one of the gamma globulins. So a lot of these blood tests sometimes cannot be interpreted if you are low in your IgA, immunoglobulin A. So it makes the blood test a little bit less reliable. I alluded to this before. This is, again, one of my favorite slides. This is the diagram of digestion in terms of where you're absorbing all sorts of different things. And if you look at it, you can see on the left-hand side that iron in particular is absorbed very high in the intestine. Calcium absorbed very high in the intestine. And as a result, if you have a lesion, if you have a problem with the intestine, the small intestine, you will not absorb iron, you will become anemic. You will not absorb calcium, you will become osteoporotic. And if you look on the right-hand column, you will not absorb vitamin A, you will not absorb vitamin D. So you've got Gehaktatsaris. I alluded to this before in terms of some of the HLA typing. If you look at number 3, DR3, That is a locus which is shared together with diabetes mellitus, with what we used to call juvenile diabetes, insulin-dependent diabetes, type 1 diabetes, all the same thing. Okay, and at the bottom you see DQW2. Again, that's another locus which has a very high correlation of celiac disease, and someone in the audience mentioned before DH, the dermatological manifestation of the gluten sensitivity. It's interesting to me, I think I have another slide, so maybe I'll talk about it then. All right, this we're going to skip. We're running out of time. This is what I wanted to talk about. Can lightning strike twice in the same place? Unfortunately, the answer is yes. Now, of interest is that we think as many as 1/4 of the diabetics also have celiac disease. And we can't explain this necessarily. Over here we can, because we see they have the same genetic locus. So the poor patient with diabetes very often can also have celiac. That's a real double whammy. Okay, now what's interesting to me is that I have a very large population of celiac patients. I have not yet had a patient who came to me with celiac who has become diabetic. Thank God I've not had that yet. And that's the experience of most people in the field. However, among the diabetics, we think 1/4 have celiac. So we know that those two correlate. Juvenile type 1 insulin-dependent diabetics. Another interesting thing that we have found, and again, I don't know the answer why, among the children with Down syndrome, there is a tremendous prevalence of celiac among the children with Down syndrome. We know that the Down syndrome children have a lot of different problems and a lot of different organs. A lot of them have thyroid disease. We are finding a tremendous number have celiac. So if any of you know anybody who has a child or has Down syndrome, they should be screened because, again, they have enough problems without having the celiac. This slide I have to put up, although it pains me to do so, but it's a question, and again, I know we have a very sophisticated audience tonight, okay, about what is the cancer risk from patients with celiac. It's a very difficult question to answer, honestly, because what happens is that the incidence of small intestinal lymphoma rises when people get into the 40s and 50s. That's just a fact of mathematics. However, there is a lot of literature now that has come out that definitely shows that if you are on the diet and you have celiac, your chances of developing the intestinal lymphoma are much less. The patients who have celiac and who are untreated, who ignore the diet, their incidence of small intestinal lymphoma rises. So there is no question that the need to follow the diet and to follow it strictly must be done. This is my paradigm in terms of how we go about making the diagnosis, and again, because of the lateness of the hour, I won't spend too much time on this, but it just tells you what to do or how to do in terms of whether you follow the diet, if you have the response to the diet, what to do if you don't respond to the diet, but I'm going to move on from that. Okay, let's talk about food. Okay, that's what we're all about, right? You are what you eat. Okay, so obviously, if you have celiac, so you cannot have anything with gluten, which is the things we talked about earlier in the presentation. What do you eat? So basically, the backbone, the mainstay of the diet is going to be 2 other grains, all right? Now, I almost got shot once when I gave this talk in a convention of patients with celiac, because Kellogg's cornflakes actually have some malt in it. Actually, it's not part of the gluten-free diet. Okay, but for illustrative purposes, corn is good. Corn is definitely gluten-free. And again, if you're not having cross-contamination, you can have corn flour, you can have cornmeal, you can have corn tortillas, you can have a lot of things made out of corn. Now I'll interdict now an interesting question which you may be getting about Pesach, because this has been coming up now in a lot of circles. There's this somewhat newly discovered grain from the Andes Mountains. I know how to pronounce this. How do you pronounce it? Quinoa. I call it quinona because I don't know how to say it. All right. Quinoa? Quinoa. Okay. So this has been brought up for a number of reasons. Number one, people want to know, can you use it on Pesach? And that I'll leave to the rabbi to discuss. Yesh deos lakano lakan. Okay. But what about for the celiacs? Now, for the celiacs, this happens to be a very versatile grain. So the answer is, from our point of view, from our perspective, again, you have to be very careful about cross-contamination, because my research has shown that a lot of this quinoa is processed in plants that also process the other grains. And I know that I read some literature, I can't remember, it was from the Starcade of the OU, who said that they poskin that in and of itself it might be okay, but they said that you have to sort of inspect it before Pesach, because there is a question that there may be some grains from other minim, wheat and such, that may have crawled into the quinoa. So that's a good find. What about buckwheat? Okay, we call that kasha. And buckwheat is a funny name, but it has no wheat. It is a completely different thing, botanically completely different. So, cross off the wheat, just call it kasha. But that's something that can be used as well for the celiac patients. And of course, how can you go wrong with Uncle Ben's rice? So rice and rice flour, rice in all of its manifestations, is something which is acceptable for the population with celiac. Now, some of the questions that, hopefully the rabbi is going to address shortly, which come to me all the time, particularly from my frum patients, is that, we're going to be talking about the Seder, if you haven't already. I guess you started. And what do we do with the Seder? What do we do with matzahs? And someone who has celiac, if you can't have any of the conventional things, what do you do every Shabbos to make hamotzi, to have a Suda, Shabbos, Yontiv, all year round? These are very vexing problems to someone who has celiac and someone who is shomer mitzvos. Fact of the matter is that you can live well without wheat. And I have to say, my opinion is that I truly believe that the next major dietary craze is going to be gluten-free. I'm seeing it already. Because there are a lot of people, there's an article in the New York Times about a year ago, that there are a lot of people who don't have celiac, but are wheat sensitive. There are a lot of people who claim that when they took wheat out of their diets, they got rid of all sorts of, many different kinds of illnesses and sicknesses. I am part of a project, I'm going to end very, very quickly. You talk about one man or one individual changing the world. I have a parent of one of my patients who has celiac. He took it upon himself to work together with some of the celiac organizations and the OU, and using the expertise of the OU in terms of their food science technology and hashgacha, and working with the celiac groups, that you will see soon, if you haven't seen it already, there are products that have a GF in a circle around it, okay? And those are products that are truly gluten-free with like hashgacha. Okay, most of them also have an OU, because I think some of the same mashgichim are looking for the gluten as well as for the kashrus. But this individual, on his own, put together this whole conglomeration of organizations, of individuals, and the number of companies who want gluten-free hashgacha is way beyond the ability of what we have to provide it. But they are as meticulous in making something gluten-free, excuse me, and certifying it as such, as the OU is in terms of the kashrus. And my last slide, I leave you with the picture of Ireland, of the Emerald Isle. So we used to have in New York something called Levy's Real Jewish Rye Bread. So we used to say you don't have to be Jewish to love Levy's Real Jewish Rye Bread. You don't have to be Irish to have celiac disease. I don't know what's going to be if you're an Irish Jew, if you have a double chance, but it's something that you can find across the board in many things. I'm going to end my talk now. Going to give the floor back to Rabbi Cohn, and I'm not going anywhere fast. So at the end, if people have questions for me, I will do my best to try and answer them. And thank you very much for your kind attention.
Thank you, Dr. Kessler. Excuse me. we'll continue right where we were. I'm now going to talk about some options that people have who are celiac, who have the celiac disease, and are not able to eat matzah like everybody else is at the Seder. And I'll mention a few ideas. The first one, which is for everyone here in the room, is for sure the most popular suggestion, is to use oat matzahs. As Dr. Kessler mentioned, oats are basically gluten-free. In the pure form, they're gluten-free. And my understanding, and which the doctor seems to have confirmed, is that most people who are celiac are able to take oat matzahs, to eat oat matzahs. So about 20 years ago, there was a person named Rabbi Kestenau, living in England, and he said he wanted to help these people. I don't know if there's anyone celiac in his family, but he wanted to help these people who were not able to do the mitzvah. And so he said, the din is the person's allowed to make matzah out of any one of 5 grains. And if oats are just as good as another grain, why not make oat matzahs for these people? He says that he's even bred a specific breed of oats that are very free of gluten. And of course, being as he is doing this for the mitzvah for matzah, he's extra careful that no other grains are mixed in. He's getting only pure oats in what he's harvesting. The matzah is matzah shmura. He's being very careful about it, and his matzahs that he makes are gluten-free. His website is even called gluten-free oat matzahs. That's the name of his website. Okay, and in fact, that's what it is, and many people use that, and he's done a tremendous service. Okay, now I'm just going to mention 2 of the issues that came up in the matzahs that he produces. These issues that are known issues. In the course of preparing for this lecture, I've spoken to the Rav HaMachshir for his oat matzahs on a number of occasions. He's shown me a tshuva that he's written on the subject to explain what goes into the matzahs. So what I'm saying is not news from that perspective, but I just wanted to share those things. The first thing is, in the production of the oat matzahs, the Shulchan Aruch says, even though all 5 grains can be used, the 5 grains that can be used are all kosher for matzahs, the minhag is that we only use wheat matzahs. The Mishnah Berurah says that the reason for that is because for most people prefer the taste, so it's considered a hiddur to use, the matzahs that people prefer best. And of course, to a person who can't eat wheat matzahs, that minhag wouldn't apply. We're not going to say there's a minhag to take the matzahs you prefer when the person doesn't eat that, all the other rest of the days of the year. Of course, that minhag wouldn't apply. However, the Marsham has a different explanation for that minhag, and he says the reason for the minhag is because the 5 grains don't all become chametz the same way. The grains, and he brings a proof from a Gemara that the grains don't become chametz in the identical form, and therefore the Marsham says the reason why we only use wheat matzah is because we don't have any experience in how to make matzah out of the other grains and how to prevent them from becoming chametz. And therefore he says that's his understanding for the minhag to only use wheat matzahs. Based on this, Dayan Weiss, in Sefer Minchas Yitzchak, says he discourages people from using oat matzahs. He says there's such a minhag, and in fact, until 20 years ago, nobody ever, wasn't common to make oat matzahs. We don't really know how to make them, and therefore we don't know how make them in the sense of how to prevent them from becoming chametz. So therefore, this minhag would say that someone should not use those matzahs, should not make those kind of matzahs because of a concern they might become chametz. Now the tshuva ends off with him saying, I don't believe that anybody really can eat the real matzahs anyhow, and therefore it's not such a big deal to eat those matzahs, and therefore I don't think you should use it because of this marsham. So Rabbi Kestenbaum himself, the one who made these matzahs, went to Dayan Weiss, as did his Rav HaMachshir, whose name is Rabbi Westheim, and said to him, they explained to him different parts of what they've done, and they themselves have done years of work into creating these matzahs, and they actually have plenty of experience in how these matzahs become chametz or don't become chametz. And they also explained to him, on the other hand, how serious it is and why people really need to have matzahs made from oats. And Dayan Weiss himself said, well, if that's true, no problem. This is just a minhag. Remember, this is just a minhag to choose wheat matzahs over other matzahs. Even according to the Marsham that we don't have so much experience, it's just a minhag, and therefore he says it's fine. A person who is unable to eat regular matzahs has no problem eating these matzahs. Okay, that's the first and the simpler concern to overcome. The second thing is, can oat matzahs be used for the mitzvah at the Seder? And of course, the simple understanding is, of course they could be used. I just told you, all 5 grains can be used. And for this, I'm going to get a drop technical in order to explain to you what the question is with using those matzahs. The Gemara says, how do we know which grains can be used for matzahs? How do we know what is good for matzah and what's not good for matzah? So the Gemara says, those grains that can become chametz are the same grains that can be used to make matzah. The Gemara says rice doesn't become chametz. Since rice doesn't become chametz, you can't make matzah out of it. Wheat and barley do become chametz, so therefore they can be used to make matzah. So now, there are 2 ways to understand what the Gemara just said. One way to understand it is that the Gemara is telling you, when you take a scoop of flour or of wheat and you're ready to make matzah from it, those grains that you're holding in your hand, the mixture that you create, the flour and the water that you make to make that matzah, has to be able to become chametz. That's what the Ramban holds. The mixture that's in front of you. So for example, if you take flour, but instead of putting water with it, you put fruit juice with it, what we call egg matzahs. If you take flour, and don't put any water, just flour with eggs and mix them together, those can't become chametz. That's what the Gemara says. They can't become chametz. So the Ramban says, and you also can't use it for the mitzvah. Since the mixture that's in front of you, even if you left it there for a month, it wouldn't become chametz, therefore you can't use it for the mitzvah. That's what the Ramban holds. And the Rambam holds, no. It's not to tell you that each mixture that you pick up has to be able to become chametz. It's that this rule teaches you which grains are able to be used for matzah. So rice can't become chametz, you can't use it for matzah. But wheat can become chametz, so wheat can be used for the mitzvah. Even if you mix that wheat with something that doesn't let it become chametz, you mix it with eggs or grape juice or something else, wheat inherently can become chametz, so it can be used for the mitzvah. Okay, so if I could just repeat that in short. The Ramban holds, the grains that are in front of you, the mixture of flour and water has to be able to become chametz. If it can't become chametz, you can't make matzah out of it.
The grain itself?
The mixture that you have in front of you, when you mix the flour and water
You said the Ramban said that.
to...
You said the Ramban said that the grain itself.
Well, the Ramban's case is actually talking about a case where the grain can become chametz, but the grain is being mixed with meiperis, with fruit juices, that now the mixture together can't become chametz. The mixture that you have in front of you, the flour and the eggs or the grape juice or whatever it is, can't become chametz. That mixture can't become chametz.
Well, what exactly did the Ramban say? Did the Ramban say that the mixture that you have right now can't become chametz? Did the Ramban say that any grain that can become chametz can be used for matzah?
Can you say 2 choices again? I didn't say that.
Did the Ramban say that any grain that can be used for chametz,
That could become chametz.
can be used for matzah, or did they say that the mixture in front of you, in whatever state it is, has to be able to become chametz?
The second. It has to be the mixture that's in front of you, the batter that you have, you do it quickly to make it into matzah. If you would slow down and would let it sit for 18 minutes, it could become chametz. That mixture, it's not just a general thought, it's which grains are kosher. It's the mixture in front of you has to be able to become chametz. And the Rambam says it's not the mixture that you have, it's just a general rule of, can this grain become chametz? Corn will never become chametz. You can't use it for matzah. Wheat will become chametz, you can use it for matzah. So the case that the Ramban and the Rambam are arguing about is egg matzahs, which is not really relevant to us, because we have other reasons why we don't use egg matzahs at the Seder. But it is relevant to another case, which is in fact our case, which is what happens if you take grains and you do treat the grains in a way that makes that they can't become chametz. Cannot become chametz anymore. And the Gemara gives an example. What happens if you take a grain and you toast it? You heat it in a way that it can't become chametz anymore. So in that kind of a case, so here, instead of taking the grain and mixing it with a liquid that doesn't let it become chametz, you did something to the grain itself. The Ramban would hold that in that case, you cannot use that matzah for the mitzvah. You did something to the grain that makes it unable to become chametz. So now the flour and water mixture that you have, it'll never become chametz. No matter what you do, it won't become chametz. That can't be used for the mitzvah. And the Rambam holds wheat is wheat, since the wheat is a kosher for using for the mitzvah, and therefore regardless of what you did to it, if you make a matzah out of it, you could eat it at the Seder. So, and this is very relevant to oats, because the common way that oats are processed is, in order to prevent them from having an off or rancid kind of a taste to them, is that they are heat treated as part of the processing. Part of turning, from the time the oats get out of the ground until they get turned into a matzah, they get heat treated long before they're mixed with the water. So that heat treatment is something that will prevent the oats from becoming chametz. Those oats can never become chametz once they've been heat treated, and if so,
Well, I'm sorry, doesn't that depend on the type and the degree in which they're heat treated? Not all oats are prepared in the heat treatment that you're describing in the same manner.
yes, you're correct. It very much depends. If you hold a second, I'm going to get to that. But the way they're processed, it's an extensive heating, and they're not able to become chametz after that happens. So what happens is, if we treat it in that way, if the oats are treated in that way, those oats, so according to the Ramban, those oats would not be able to be used for the mitzvah, and according to the Rambam, they would be able to be used. Okay, well, what's the din? We have two shittas here as to whether they can or cannot be used for the mitzvah. The Achronim have, again, quite a discussion about this question. Can they or can they not be used? Many of the Achronim say you should not use them, and the Chayodim says, if a person is stuck, they have no choices, yes, they should use it. If they have no choices, they could use it. B'shas HaPchak, he says, we rely on the Rambam that a person could use it. But if a person had a choice, because of this question as to whether they can be used or not, he recommends that you not use them. Okay, so this is a question. And again, the person who has no choice, a person who this is their only way to do the mitzvah, yes, they should use them. But if a person did have a choice, because of this question, they would preferably should not use that matzah. So a person who has, again, he can't eat the other 4 grains of matzah. He can't eat the wheat matzah and the spelt matzah. It's not going to work for him because he's a celiac. He can't eat it. So what should he do? So he eats the oat matzah. That's what he should do. He is stuck. However, as one person for sure here in the audience is aware, in the past couple of years, somebody else started making oat matzahs. And they don't heat treat their oat matzahs. They produce their oats without this step, this heat treatment.
Where they're getting those from?
Where do they get their oats from? This is an American company. I don't know where they farm the oats from. They
Scrubbed oats?
Yes, they are.
Tested gluten-free?
Yes, they are tested gluten-free. Again, I'm not a judge as to whether their testing is accurate. I send that to the doctor.
The thing you sent me, the oat matzah was tested at a reliable laboratory in Nebraska, which
John, I'm sorry, point of reference. I take it you're referring to the one in Lakewood, New Jersey.
Lakewood. Mm-hmm.
I emailed Mr. Davidovitz,
Yes.
who is the owner, Israel Davidovitz. He responded to me. First of all, there is, for those people who are really, really nervous about gluten contamination, they should know that the bakery does also make those matzahs which are wheat and spelt in the same kitchen. However, they start every year making only the oats before they make the wheat and spelt. This is the second year, however, that they're doing it. They only did it 1 year last year, and this is the second year. So just those people who are pretty sensitive to cross-contamination issues, they should know also that in answer to my question with regard to the testing was done last year, not this year.
Okay. Okay.
That's what the email is.
Okay. So
They don't batch test.
okay. So again, I can't vouch for the whether to rely on that. Dr. Castle, that's more his side as to whether that testing is reliable. And again, I'm not. I've heard the same thing that you said. That in fact they run it first. Matzah bakery is closed for 6 months a year. So when they start up again, the first thing that they run is their oat matzahs.
I hope it's clean then.
But when you run a hand matzah bakeries are built for, I don't know if it's the technical of the scrub, but they're built to be broken down completely and, clean thorough. That's the way hand matzah bakeries are built. That's what they're built for. And after being down for 6 months, they then do these matzahs first. And the testing seems to bear out that, in fact, they got it right because the testing, what it seemed like, to me, to the layman, seemed like it came back that it was okay. So those matzahs, they don't heat treat their matzahs. And because of that, there is, from the halachic perspective, I'm not, again, not from the gluten, that's a Yes, good doctor question. From an halachic perspective, there's an advantage to those matzahs over the ones from that are coming from England, the ones that have been around for a very long time. Okay?
Can I just ask a question?
Sure.
Are you saying that because there's these two options, that a person it's impermissible, a person doesn't fulfill the mitzvah of Achilas Matzah Pesach if they're eating Rebbe Kessenbaum's
No.
matzah?
No, I didn't say that. No. It's a question whether you could use that matzah. And the Chayyim says, if you have no choice, yes, you should use that matzah. He wasn't talking about oat-free gluten matzahs, but in describing this situation, the Chayyim says, if you don't have a choice, yes, you should do it. They asked a Shaila 10 years ago to Rav Vosner, who's related actually to Rabbi Westheim, and he said, could we use these matzahs? And he said, if a person has no choice, yes, you should use them. But it's a question, halacha, and if you have no choice, yes, you should use it. And I wouldn't tell a person he didn't do the mitzvah. Yes, he did the mitzvah, there's a machlokes, and this is what you're supposed to do. The question is when I have the other choice, if I do have the other option. Right now in Kol Tov, they sell the liquid matzahs. So if I have the option of buying those matzahs here, that there's a preference to those matzahs.
Just for the Achilas Matzah, so for the Siddur.
I'm only talking about for the Seder. That's what I'm talking about.
For the Kazayas, for all the Kazayas.
I'm talking about for the one, to eat one kazayas. One kazayas, right? That a person has to eat, the mitzvah derises to eat one kazayas. I'm not talking about what you want to make your knedlach out of, what you want to eat other matzahs, even at the Seder. So about one kazayas on the first night even. One kazayas on the first night, there's a preference to those.
Well,
Yes.
This might be sort of directed at both you and the doctor. Based on the information that he gave us, where we don't know whether they tested this year, they don't batch test, it could very possibly be a threat to somebody's health and life, whether immediately or later, to eat those matzahs. So you're saying that we should still go and eat those matzahs?
Okay, so the answer is, you're right. First person has to ask is Dr. Kasla. That's the first person to ask. After he'll respond to that question, then, I'm not going to have much to say then. Go ahead.
I would say again that everyone I think in this room realizes that no one who has celiac should in any way, shape, or form jeopardize their health by taking something which may be contaminated with gluten. Okay, I think that's a given. I think the rabbi would say that that's the halacha as well. One is not, except for the three cardinal sins, one is not supposed to put one's life in danger for any other mitzvah. So, again, the rabbi sent me the certification that the liquid matzah was tested and was found to have less than 1 part per million, or even maybe less than that, of gluten. So the matzah itself was tested. Okay, so that much we can say, that the matzah itself is gluten-free, meets the criteria that we would find acceptable. The big question is that potential cross-contamination that I don't know if we can answer or not. But and again, your question about the batch deception is a very good question. And hopefully the owners, they're obviously doing this because they are marketing this to people with celiac, which unfortunately is a growing population by the day. So I would like to think, I might be naive, but I would like to think that they will take every precaution in terms of gluten as they are taking with Kashrus. Okay? But there's no way of knowing that 100%. But I'd like to think that they feel that responsibility to the people to whom they are marketing this product. But the product itself appears to be gluten-free, and if we can be assured that there is no cross-contamination based on the Rabbi's lumdus, it sounds like this may potentially be the best of all possible worlds for our patients who need it.
Okay, now, yes, go ahead.
You mentioned a kazaya, so ignoring which matzah you're using for just a second, how much should be considered the amount for kazayas for somebody with celiac disease? It just getting to the point, for example, and I mentioned this to a couple other people here, we were discussing it for a few seconds, how much of the oat matzah do we actually have to eat? Because at a certain point, people with, I find from personal experience, I have celiac disease, after a certain amount of eating the oat matzah, I can't tolerate the oat matzah itself anymore. How much is the amount that is the kazayas? How much are we supposed to be eating at the Siddur?
Okay. I actually passed this by Rabbi first, who said the smallest shear that someone will tell you is acceptable. Okay? In other words, what I might eat at my Seder, because I'm trying to, for sure that I did the mitzvah and, really cover myself. A person who's has some special reason why they shouldn't be, like this, should find a small shear. Ask your rabbi, or we could talk about it afterwards. Within the legitimate shiurim, a small shear, and they've done enough. They don't need to go overboard like other people might choose to do. Okay, and I mentioned before, we're talking about one kazayas on the first night. That's the mitzvah device. After that, everything is,
At which point? The
Okay, if you wait, I'm going to get to that in a second. Okay, I have to tell you that Rabbi Westheim, who's the Rav HaMachshir, he gives the hashgacha on the matzahs from England, said that he has other reasons why he has been encouraging the people in England to stop heat treating their matzahs. Okay, a halachic reason. He has another, which we're not going to get into, another halachic reason why he's been encouraging them to stop heat treating the matzahs. Now, what he's suggesting, when he's saying, please don't do that, of course, that's not the way you process oats. He said, but now that I've told him that in Lakewood, they don't do the heat treatment, he now feels, re-inspired to get them working on it, that they should figure out how to not heat treat their oats as well. So what I'm telling you today, for next Pesach, may not be true. By next Pesach, the people in England may have also figured out whatever the, so to speak, secret is to how you produce oat matzahs that taste good without heat treating. They may figure it out themselves. And by next Pesach, the English matzahs may be just as good from a halachic perspective as the matzahs coming out of Lakewood. Okay, so what I'm saying to you is, this year's matzahs are done. They themselves, let me just finish, the people in England themselves are looking into the possibility of not doing this heat treatment. And if they're able to accomplish that, then they will be on par with what's going on in Lakewood. Yes, go ahead.
So one of the reasons for heat treating oats is to prevent spoilation.
Mm-hmm.
To prevent spoilage of the oats. And one of the things that celiacs do is they stock up on the oat matzah during Pesach so that they can have what to make motzi on during the rest of the year. So if they don't preheat the oats, do we have any knowledge as to when the oat matzahs from Lakewood are going to spoil? Because we know that the matzahs from England don't spoil. I have matzahs that are 2 years old.
Mm-hmm. Okay, so it's a good question. I've spoken to people in Lakewood. They believe that what they do, and I'm not at liberty to describe more what they do, they don't think theirs will spoil. They think that with the way they're taking care of their oats, they avoid this whole concern of them turning rancid, even without the heat treatment.
Well, but if they're treating their oats, even though it's not heat treated, so that it doesn't spoil in the same way, then it can't become hummus in the same way.
It's not correct. I can't explain to you what they do, but what they're doing has nothing to do with making it more or less hummus. Okay, but I have to tell you another thing. Just for you said you're stocking up on oat matzahs. The people in Lakewood only make canned matzahs. They don't make machine matzahs. I presume that most people who are stocking up for the whole year are stocking up on the hand matzahs. Okay, and the hand, I just imagine that. The machine matzahs. I'm saying the machine matzahs. Okay, England is the only one who makes the machine matzahs. Okay, and what we're talking about here is only about whether you could use it for the mitzvah at the Seder. The oat matzahs that are being made, even if they're heat treated, are fine for every Shabbos. There's no reason not to take those matzahs and save them for the whole year. They're perfect. They have no, there's no disadvantage to the rest of the year. I guess your question was, if England would stop heat treating it, will that affect the quality of their matzahs for storage? If they do it like in Lakewood, I don't believe it will. I'm not the food scientist, but from my understanding, it does not affect it.
My second question is,
Go ahead.
those people who've already spent $100 on matzah this year, buying Rabbi Kessenbaum's matzah, they don't have now another $100 to spend on matzah from Lakewood. What do you say to that?
Okay, that's an interesting question. I believe that's a personal question. That's something for them to turn to a rabbi and say, this is my situation, this is what I've done, and I think it's very much dependent on the person and how much for that person they're putting themselves out.
But
They've gotten the matzah.
You can't spend more than 1/5 of your
Right. So that's a very personal question. Very much dependent on the person's situation. If for me, for what me spending $100 and the next person spending $100 is not the same thing. I think it's a very personal question to their situation. Whether they have to go the extra mile or they could be satisfied with what they did. Okay. I'm now going to move to two other choices. And the other choices that I'm going to mention are by no means first choices. I just mention them just for, so to speak, for what they're worth. The Shulchan Aruch says if a person makes, now what I'm about to mention does not exist as of today. If a person makes a matzah with the 5 grains, but he mixes those 5 grains with rice, okay, that is to say, he makes up a batter, instead of making a batter of flour and water, he makes up a batter of rice, flour, and water. Rice, wheat flour, and water. If a person does that, those matzahs are kosher. You could use them at the Seder. Not only that, how much wheat do you have to have in those matzahs? So the Shulchan Aruch says it just has to have a taste of wheat in it, okay? A very small amount. And the Mishnah Berurah says some say it has to have a 1/6 wheat and 5/6 rice. That is to say, if we made a matzah that was 5/6 rice and 1/6 wheat, okay, or according to the Shulchan Aruch, even less than that, maybe we'd say 90% wheat, rice and 10% wheat, that matzah you could use for the mitzvah, and you don't have to eat a kazayas worth of wheat then, you have to eat a kazayas worth of the matzah. The whole matzah is considered to be a kosher matzah, and by eating a kazayas of that matzah, you could be yotze the mitzvah. So that is to say, if such a thing exists, it doesn't exist today, but if such a matzah would exist, the person would be able to eat his matzah by eating only a 1/6 or a 1/10 of a kazayas worth of wheat. Now, that again, as I said, that's not a great option because nobody wants to eat any wheat.
It's not an option, so
Okay, I'm going to ask. Actually, I was waiting for Dr. Kazler to answer, so I'm going to ask him right now. I was waiting for him to say it in his speech. If you could just explain to us, what we of course understand that a person who's celiac needs to be on a gluten-free diet. Okay? Could you explain it? Maybe you may have talked to me a little bit about this. What's the reaction of a person who would eat that kazayas? That's very much your question. A once-a-year thing for a person to do that.
Okay, I think it's a very good question, and this question comes up all the time. Parents will always say to me, and again I deal with children, what happens if you make a mistake? A kid goes to a birthday party, whatever. There's a well-meaning relative, who hands the kid something made out of gluten. So the medical line is, and it's unequivocal, that once you have been diagnosed, there's a zero tolerance. You can't cheat. It's not orthodox, conservative reform. It can't be a reform celiac. It doesn't work. You have to be totally and unequivocally gluten-free. That's the party line, and you never are allowed to consciously take in gluten. It happens, and what happens? Well, that's very variable from patient to patient. There are some patients, I would say a distinct minority, who are idiosyncratically, meaning, people, there are some people who have like peanut allergies, or some people are allergic to penicillin, whatever it is. Some people are so hypersensitive that they will react to a drop of gluten, like somebody with the severe peanut allergy, or somebody with the severe penicillin allergy, that they will have what we call a celiac crisis. They will go into profuse abdominal pain, diarrhea, and in the worst case scenario, they can go into shock. That's extraordinarily rare. The overwhelming majority of patients with celiac, the answer is, as far as we know, clinically, nothing will happen. Okay? Because we know it happens not infrequently. However, internally, we know that if you take any measure of gluten, you can undo many, many months of being gluten-free. Okay? And we've mentioned this before, that the clinical manifestations, how a person behaves, do not necessarily reflect what's going on internally. So that l'chadchila, to allow this type of matzah would be, for us, medically totally unacceptable. And I think the people in the audience are aware of that. But on a realistic level, it happens, and it happens all the time, and probably, again, an accident here and there probably will not affect the patient at all, as long as it's rare. But if it's not just accidental, and if, they're patients, particularly adolescents, who are the most notorious of all patients, think that they can fool somebody and get away with things. That's why we have the blood test, because we can tell them, a day later, you've been cheating. Okay? But we cannot condone consciously taking any drop of gluten with pre-knowledge. It would be medically contraindicated. So this matzah
Okay, so
would be
good. So
unacceptable to us medically.
okay, so I'll go back to what I said beforehand. That even if we will say that the person, even if you let me finish my sentence, is not even if we would say that it's not what the person eating one kazayas is not a sakana, but we'll just set him back a couple of months. I mean, he's been clean for 2 years, and now he's set back 6 months by eating that one kazayas. We have seen that a person is not required to go to that extent to do a mitzvah say. To do a mitzvah say, a person is not required to make themselves sick, even if it doesn't lead to danger. So that is to say, even if we say that case is rare enough that we'll ignore the sakana, even if we would say, even the fact that the person will be set back a couple of months is enough reason to say that person is excused from doing the mitzvah say. So a person does not need to go and do that mitzvah say. A person, just like he doesn't have to spend more than a certain amount of his money, he doesn't have to make himself sick and sending himself back 6 months of his diet. Yes, that's making himself sick, and he would not be required to do that. Okay. To answer the question that someone had asked, what happens if a person is eating only one kazayas at the Seder? That's all they're having. They're just having one kazayas. For whatever reason, they're having just one kazayas. So there is a din that logically we might think that what he should do is when everybody else eats matzah at the Seder, at the beginning, after you finish Magid, he would go and eat the matzah also. In fact, that's not what he's supposed to do, because if he does that, he won't eat afikomen. We're supposed to finish off, the last thing we eat is supposed to be a matzah, and if you eat matzah at the beginning, that is right after Magid, right at the beginning of the meal, he'll be passing up his chance to eat matzah at the end of the meal. So what the person is supposed to do, a person who will only be eating one kazayas of matzah, should not eat it at the beginning of the meal. When everybody eats matzah, he should just sit there. He should eat maror. He should eat the full meal without washing. Eat the full meal, and at the end of the meal, he will wash, make a hamotzi, make an al achilas matzah. When everyone else is eating afikomen, he will do what they did at the beginning. An hour ago, what they did. He washed, made a al achilas matzah, and not moitzi. I said that order backwards. And he make hamoitzi in the achilas matzah at the end of the Seder, at the end of the meal part of the Seder. Okay. If a person is eating no matzah, okay, a person's at a Seder, and they forgot, or they ended up someplace and they're eating no matzah, because they can't eat the wheat matzah, and they don't have any other choices, they're not eating any matzah, there's a slight variation to their Seder. At the end, this is, the Bir Halacha says, when you get to the end of Magid, you make a long bracha. Okay? I don't remember the whole bracha, but the bracha goes at some point, V'giyanu halayla hazeh le'achoboy matzah umor, kein Hashem l'keinu yagenu, etc. The person's supposed to leave out the words, le'achoboy matzah umor. If he won't be eating matzah, those words, that's saying Hashem has brought us to this point that we're able to eat matzah. If a person, in fact, will not be eating matzah at the Seder, he should leave those words out. He should say, V'giyanu halayla hazeh, Kein Hashem, whatever. You pull out those 2 words. Okay, you pull out those words, you just snip them out of your Haggadah, and you skip out those words. Okay, thank you. I assume people have questions. Probably more for the doctor than for myself.
Yes.
There's been an issue over on Pesach where a lot of people say, for people with celiac disease, it's a lot easier on Pesach for them than during the rest of the year. Unfortunately, there has been cases within Jewish companies where they don't not to makmer on polyethylene regulations, and stuff such as pieces of matzah meal get stuck in jars of food, and people sometimes get reactions because they're opening up a jar of pieces of peaches and there's matzah meal, a little piece of invisible matzah meal in there. So, what is the rule for going about that? Is there a way to say that you are allowed to go and get the jar of peaches that isn't specifically from the Jewish brand instead of the Jewish brand, which is possibly hurting you?
In other words, you say something that doesn't say OUP might be OU gluten-free, but doesn't say OUP.
Right.
We know it's kosher, we know it's gluten-free,
Right.
it hasn't been blessed with this year's...
All right, so that's, I think, the question for the rabbi, but I'm going to just answer a different part of your question and say the following, that at least in the New York area, and I'm not sure how much of a help this is to you out here in the Midwest, but I think it can be, given the modern conveniences of UPS and FedEx and all the shipping that's available in all sorts of its manifestations, freeze-dried, etc. There are bakeries in the New York area, and again, for the celiacs, they obviously look forward to Pesach every year because if you are nishgebracht, okay, that means, again, we're relying upon the religiosity of the provider to maintain that, because for the people who are truly nishgebrachs, for them having that matzah or whatever, for them is totally unacceptable. And we know that in this area, by and large, our brethren in the business are reliable. So that, at least in the New York area, there are a number of bakeries who are kosher Pesach, nishgebrachs, that bake all year round to service the celiac patients. So for them, it is, this is their, if I can use the term, bread and butter. This is their parnasa, and they have a vested self-interest in making sure that, no mistakes happen. Okay, so that's one part. So I think, excuse me. Hello? Yes. In terms of, I think the Rav has to answer that question. If it's OU and gluten-free, do you need a special hashgacha that it's also kosher Pesach?
To that I would answer, that is in fact a more Kashrus question, and I would do it, if that was your situation, I would do it product by product. And I say you need to sit down with someone who's familiar with how food is produced. It's really unlikely that in what you described in a can of peaches, that's not processed in ways that would possibly pick up gluten. But there are other foods that could. I don't deny. I understand what I'm saying. So you have to sit down with someone and say, let's go through them, see how serious the chametz concern is for that food versus how serious the concern of the gluten is in that food. And someone who understands how the food is made who could sit and go through that with you. They're trying to do it piece by piece.
Here's the problem. For example, with many of the kosher brands, they farm out. They would be happy to tell you if it's gluten-free if they knew. They don't.
I didn't say there's the company.
No, I understand. So I remember previous years I would call a particular well-known brand and say, what about this? Is this gluten-free? I don't know. They can't tell you. They don't know because they don't make it. They ship it out. So as my salon was saying, we're not talking about stuff that's obvious. Some things we say, has to have OUP or whatever, kosher for Pesach. But we know there are products out there that are kosher all year round that are gluten-free. And I'm saying by definition, because of hamadaktik they have to be with the gluten, it should be considered.
So the answer
that's
is,
my question.
If I can give you an example.
So if
I can give you an example. I once looked at a spec sheet for schnapps. Okay, and a spec sheet that was not written for kosher. Company had, if I remember, it was a 7-page spec sheet to describe their product for people who would potentially want it. And at one point there was a question that said, is it gluten-free? And they said, yes. And of course it was, because it was made from barley sugars, not barley protein. And I'm not here to judge whether they were right or wrong. But the product was 100% chametz. Okay, but from a gluten perspective, it was gluten-free. So what I'm saying is that it's really a product-by-product question. You could sit down with someone and say, I have this product. It's gluten-free and I want to use it. Do you think that I could use it even though it's not certified for Pesach? Should I take the gluten-free as meaning it's kosher Pesach for my needs also? So you really need to step product by product and say, these are my 10 things. Can I take this one? I want the gluten-free. Can I therefore trust that it's also acceptable for Pesach?
I believe that they weren't processed. In other words, they were whole, whatever.
So again, I'm saying it's a product. I'm happy to spend time with you. It's someone who understands how you make the food, have to do it product by product. I don't think it's an across-the-board answer.
The kidney is issues also.
Well, a person who's a celiac doesn't need to worry about kidneys. Kidneys is a minhag which is waived for people who are sick or in a difficult situation, and that person would not worry that I'm going to be in kidneys. But I have to tell you something. eating kidneys is not automatically an option for someone. And I'll give you an example. Dr. Kaz mentioned cornflakes. It says right on the package that it's made from barley. It has barley in it. It has barley malt in it. I'm sorry, cornflakes. Cornflakes has barley malt in it. But the way you make many rice drinks, many may be familiar with this, the common enzyme that's used is a barley enzyme that's used for that. So someone who's familiar with how you make the food would know that a rice drink can be hummus, even though it appears to just be kidneys. So before you jump and say, I'll eat the kidneys, the person has to think and say, is this food that I'm eating only kidneys, or does this food potentially have hummus in it also? So that's a question. You got to go product by product. Say, these are my 20 things that I eat. Can I eat them on Pesach also?
What about asking one of the local Sephardi rebbeim who do have lists of foods that are kosher for Pesach for kidneyot? What about asking one of them?
That's a good option. I believe that they prepare those lists in consultation with people who are Catholic. That is a partnership they're doing. Yeah, that's good. So that's a suggestion.
I'd just like to, on behalf of Dr. Friedman, who was not able to come, to thank Dr. Kaskov and Rabbi Kuhn for being able to come. And if anybody has any questions, if some of us continue to stay, there are some forms that Dr. Friedman would like people to fill out. So we're going to put them on the table. And thank you, everybody, for coming.
Thank you very much. No such thing.
So what are you saying? Someone that's celiac can eat rice? When you Matzah came, I never heard.
It's not ideal.
So much stuff.
Not ideal.
So if you feel it, I don't think it's a minimum.
No, that's a real cross-contamination issue.
As a second,
Yeah,
you mentioned
I
about
would say.
speed and then rice flour. So Rabbi Friedman would share regarding banking. It's like 6'3", like the wheat part.